Okay, in this section we'll look at the bony thorax, the thoracic cage. Here you're seeing an anterior view of the thoracic cage. It's made up of the sternum, which is here. The sternum has three parts: the manubrium, the most superior part, the sternal body, and the xiphoid process. The xiphoid process is the one that you do not want to break off during CPR. So that's why they teach you to go, several finger widths above this area as you find the rib line and contact the sternum about there in the middle, and you press down to pump the heart. A function of the thoracic cage is to protect the vital organs on the inside. Also helps with movement and breathing. The thoracic spine and ribs is very painful if subluxed. And if a rib head does move out of place or subluxes, that can compromise breathing. It just hurts to take a breath in, because as you breathe, your rib cage does move. The rib heads, they do pivot along the costal facets. So if they sublux, you get that rib head jamming against the costal facet, which creates local inflammation, which creates pain and spasming, muscle tension, and so forth. And that is fixable by putting the rib head back into place and doing all the PT work to calm down the muscle spasm. Auscultation of the heart. This is a fancy word for using a stethoscope to listen to the heart. What I do want you to know from this is that we do have 12 pair of ribs, and they are named top to bottom. So rib 1, rib 2, rib 3, or costal, which is a fancy term for rib. Costal number 1, costal number 2, and so forth, all the way down to 12. And then if you'll notice, we have a space, an intercostal space. And they are named intercostal space 1, intercostal space 2, and 3, and so on. This is the right side. Over here we have intercostal spaces on the left. When you take a stethoscope and listen to the heart, it's best to listen to the heart through the space. Sound travels better through the space rather than over bone. So now this is something that you'll learn in A&P2. I certainly hit this pretty hard as we do it in lab and lecture, going over auscultation of the heart and the valve sounds and so forth. But for right now, what I do want you to know is the heart does lie posterior to the sternum and the rib cage. And when you listen to the heart, you want to make sure that you are in the intercostal space. So here on the right side, this is second intercostal space, and you're listening to the aortic valve. On the left side, second intercostal space is the pulmonary valve sound. Third intercostal space is Erb's point. This is where the S1 and S2 heart sounds are equal. In the fourth intercostal space on the left, this is tricuspid valve. And then the fifth intercostal space on the left, mid-clavicular line, is the mitral valve, also known as the bicuspid valve. So you place the stethoscope in those spaces, and depending on the space is the valve sound that you're going to pick up on. Now these placement of the stethoscope is not necessarily the actual anatomical part of the heart. That's just where you pick up on the sound the best. Okay, this statement here, please know this is very important. This is also a board question. And the reason why it's a board question is this is how you palpate and think out loud with your lab instructor. So in nursing school, PA school, and all that, when you're doing your lab practical and you're describing how you're locating the different parts of the heart, you have to palpate your patient. And since this is, a student lab test, you have to think out loud so your instructor knows that you know what you're doing. So on boards, they also put that because they want to make sure that you know your landmarks and be able to locate the heart that's within this area. So let's go over it. The jugular notch is about the T3 area. So I'm going to back up. So this right here is the jugular notch. Okay, it's basically in between the clavicle there. That's the jugular notch. That area is significant because the jugular vein comes down, and in some people with a heart problem, blood is not draining properly from the jugular vein into the superior vena cava going into the right atrium of the heart. So they get back up, and the jugular vein will distend, and you can measure that, you can see it. So as you're doing your assessment, they're going to want you to palpate the jugular notch area so that they know that you know what you're doing, where the jugular vein is, and so forth. Okay, this bullet here, the sternal angle, this is where the manubrium and the sternal body meet, and it meets at the second intercostal space. So let's back up. Okay, right here, there's the rib 1, space 1, rib 2, space 2. Okay, the angle is right there, second intercostal space, sternal angle. That is a significant area of palpation because that is how you're going to find your intercostal space to place your stethoscope to start listening to the heart. Okay, then the xiphosternal joint is about T9 area, and you want to know where that xiphoid process is because you don't want to break it off during CPR. Okay, this is also a picture showing you where the jugular notch is, the manubrium, sternal body, xiphoid process. Okay, there's your sternal angle right here. Sternal angle, it's where the rib 2 comes in to that sternal angle, and then just below that is the intercostal space. The sternum is also used for bone biopsy. A biopsy is where you take tissue sample. The sternum is very superficial, so you don't have to go through a lot of soft tissue to get to it. So the bone marrow is easily obtained. That's called a surgical puncture, where they go in and extract bone marrow from the sternum. And they're looking for different bone marrow disorders, cancer, other tests that they can run. Okay, question here. What vital organ lies posterior to the sternum? The answer would be the heart. And what procedure is therefore successful using the sternum? And that would be a variety of answers. One is CPR. That's the best answer for this one. Okay, here's a picture, an example of a sternal puncture where they go in, extracting tissue and bone marrow. And then here's your chest compressions for CPR using the sternum for that. Okay, we have 12 pair of ribs. A fancy term for rib is a costal. So we do have 24 ribs total. The first 7 pair are considered true ribs because they actually attach to the sternum. Okay, so ribs goes from the posterior thoracic spine and then wraps itself around to the front to the sternum. The false ribs are ribs 8 through 12. They are false ribs because they do not have a sternal attachment. And then you have these floating ribs. Ribs 11 and 12 are floating ribs because the distal end of that rib does not attach to anything. So they call it a floating rib. Okay, you can see that here, there's your floating rib where as you work your way distally, there's really no attachment. Now this rib is good for muscle attachment, but it does not have an articulation with anything at the distal end. And they color coded it here. Your first 7 pair of ribs, true. 8 through 12, false ribs. Ribs 11 and 12 are floating ribs. Okay, here's another picture of how the rib has a posterior attachment. This is your spine, so this is the posterior side of you. Here's the sternum, so that's the anterior side. The rib does move from the posterior to the anterior. The rib, the bony rib itself, does stop about there, and the rest of it is costocartilage. The cartilage is there to help with thoracic cage movement with breathing, gives it a little bit of flexibility. Here's a superior view of the thoracic spine. You're seeing the body of the vertebra. There's a vertebral foramen where the spinal cord passes through. Spinous process. Okay, so here is the rib head, and it articulates with the thoracic spine, and also your articular facet there. And then the rib would wrap itself around to the front. Okay, so these are painful when subluxed. Once moved back in, and then you do your soft tissue work to calm everything down. For the most part, brand new body. People feel great. Okay, we've gone over some of this. Now, with the rib angle, it's also known as the angle of Louis, so do know the AKA. That angle of Louis is where the cartilage of the second rib comes in. Okay, we looked at a picture of it earlier, but now add the word angle of Louis. Okay, so from this one, know the first bullet, the suprasternal notch or a jugular notch, the angle of Louis. And that's it from this one.